Thanks for staying with us. Dr. Mukhtar Dati Ahmed joins us right now from UK via Skype. He's a consultant, surgeon and clinical director. We've had him before. Just wanted to get some further direct understanding about this whole thing that we're talking about. Thanks once again for joining us. First of all, a quick update. What's your take on Nigeria's response to the handling of COVID-19 so far?
Good morning, and thanks for having me once more. As an observer, as a Nigerian observing from the outside, a lot of anxiety initially, but I think the response has gone into a higher gear. There's clearly better coordination between the federal and the state governments. The measures of reducing social interaction seem to have been adopted a lot more around the country. And we are seeing improved provision of isolation facilities, better testing. There's still a lot more to be done, but I think we're in a better place now than when we last spoke about this.
Well, speak to us broadly about this thing that's going on all over the world, about COVID-19 symptoms as opposed to malaria symptoms and, those other things. I'm sure you have also been aware of these controversies and how that, many say that they only get malaria treatment and then they eventually test negative for COVID-19. Is there some confusion somewhere that people need to understand?
I think, speaking to colleagues who have treated people with COVID or suspected COVID symptoms in Nigeria and clearly even here in the UK, the first thing to say is that the symptoms of COVID could mimic many other febrile illnesses that cause fevers. If you look at the symptoms, if you take out the cough and the breathlessness, you could, if you had fever and body aches, what we call myalgias, which are body muscle pains caused by many viral illnesses, you will find that there are many other causes of that, from malaria to typhoid to other viral illnesses, which we already have in Nigeria and the tropics. In the UK, it mimics other viral illnesses, the common flu and many other things that could cause it. And that is what has made diagnosis and management of COVID difficult, and why testing is very important, because any illness could present, any infectious illness could present with a fever and body aches. So I think, there is a large group of people who would have symptoms that would be similar to malaria and could have had COVID. The question of whether antimalarial treatment made them negative is something that hasn't been proven. It is quite possible that they had malaria as well. We also know that you only shed the virus for only a few days. And even without treatment, you would subsequently become negative. So, and we've, suffice it to say that in the UK and most of the Western world, treatments are largely experimental. They're in clinical trials. So the vast majority of patients don't get any direct treatment for coronavirus itself, but supportive care to help them to recover.
What is the mood then there in UK where you are? I know globally people are eager to move on, but what's the mood at the moment?
I think there's a lot of caution in the UK. The government has relaxed the restrictions here slightly. They've allowed people to go out more than once a day to exercise. They have opened certain types of shops like, do-it-yourself shops or construction shops and gardening centres to allow people to engage in other activities and to allow the construction sector to start, because they're one of the sectors prioritised. But having said that, coming to work this morning and certainly over the last week since the restrictions have been relaxed slightly, there is not a significant increase of people going out. People are very cautious. They're mindful that there is the possibility of a second wave if everybody suddenly starts coming out. A lot of people are still opting to work from home if they're able to work remotely. There are plans to open primary schools, the early years of primary schools in the first week of June. But many parents are reluctant, hesitant to send their children to school for fear that their children could get the virus and pass it on to them. So I think a lot of caution. I think there's optimism that we've got past the worst of it in the UK, because we're now in the low hundreds of cases per day. We had the lowest number of cases yesterday since the lockdown started, just over 100. So I think there's a feeling that we're past the worst, but without a vaccine, the fear is that there is the possibility of a second wave, and people are very cautious.
Not even the Bundesliga is changing all of that, because I know in UK, the football means a lot to them.
Sorry, not even
the German league reopening. So that is not making any impact or influencing their thinking.
Yeah. Strangely, there is not a lot of push. I mean, as you know, the UK is a huge footballing nation, but there isn't a big push for the Premier League and the other football leagues to start. And I think it's partly because people know that when the leagues start, they're going to start with empty stadiums, so-called ghost matches, with just the teams and the officials in the stadium, but no spectators. And the reviews from Germany, from a lot of the German fans, were not hugely positive. And here, the football is part of the culture. It's not just watching the match, but it's the atmosphere for those who go to the matches, engaging with the crowd. And, the players feed off the crowd, and vice versa. And I think it's going to be different. So there's a lot of caution. I suspect it will come, in the coming months, or weeks even. But there isn't a big clamor for the leagues to start.
A lot of people are definitely looking forward to that. We'll talk about, vaccine trials and antibody tests in a moment. But currently, UK is ranked 4th in terms of confirmed cases in the world, over 243,000 confirmed cases and over 34,000 deaths. But usually when you try to get a figure of people that have been discharged, you hit a block, because there seems to be no rounded figure coming together of figures in terms of people that have been discharged. And people are saying, where is that glimmer of hope, so people can look to that usually? Is there a thinking around why that is not the case in the UK, to have a figure for people that have recovered?
Yeah, so I think the reason why it's not included, the data exists, and certainly the number of people discharged from hospital has been reducing significantly. The data exists, but the UK publishes what is the international, comparison. And because the vast majority of people have a mild illness and they don't get admitted to hospital, the data of hospitalized, and it's important to make the distinction. So largely in Nigeria and in many other countries, anybody who tests positive is taken to an isolation center. That is not the practice in the UK. So in the UK, you isolate at home. So nobody tests you again to check that you're negative before you discharge. So the figures of who's recovered and when you have recovered are difficult to compare, say, between the UK and Nigeria. In the UK, you would only be admitted to hospital if you have a more severe form of the illness and you require support in hospital. Either, one of the systems in your body is not working well, like when you have respiratory problems, when you have difficulty with breathing particularly, or other complications of COVID. But the vast majority of people who have tested positive have never been admitted to hospital, and they would have been tested out in the community, and they do not get retested. They just get asked to isolate for 7 days after the onset of their symptoms.
All right. There's been a lot of talk about vaccine trials now, antibody tests and all that. What can you tell us? What's the update regarding that?
So there was some good news over the weekend. Clearly not my field of expertise, but I'm very interested in it, and I've kept abreast with changes in that field. In the UK, there are 2 big centres, the Imperial College in London and the Oxford University team that are trialling the early stages of trials of 2 vaccines. And there are another 9 roughly around the world registered trials, some in the United States, Canada, other parts of the developed world and China, that are looking at different vaccines. In the UK, there is the potential, was announced that by later this year, say by November, there might be a larger scale trial of vaccinations. The government has spent hundreds of millions of pounds, or earmarked hundreds of millions of pounds to support these 2 centres in London and Oxford for the next stage of the trial. So tests have begun on human volunteers. It is test the side effect and to see whether there's a good response after, in terms of producing antibodies. So just to recap, the way these vaccines work is to expose the body to a fragment of the virus that then instigates a response in the body's protection system, the immune system, to produce some substances in the blood called antibodies, that if you were then exposed to the virus, these substances then gear into action to kill the virus, to stop you getting a severe form of the illness. So there is a lot of hope, and there's a lot of international collaboration to ensure that when the vaccines become available, that the rest of the world will benefit from them. In the UK, there has already been talk by the government of clearly prioritizing the British public when the vaccine becomes available, but finding ways to ensure that the low and middle income countries have access to the vaccine in as short a possible as time and in as affordable a way that is possible.
Back home here, we hear of cases where hospitals are afraid to admit patients because they don't know if they have COVID. And as a result of that, those who have other ailments are really having a hard time. How is it playing out there? Are you still doing surgeries? How are they handling it?
So, in the UK, the UK, has planned. The planning in the UK was very good. There's criticism of whether we should have locked down earlier and whether that would have reduced deaths. But the National Health Service here planned extremely well for the surge in COVID cases. So going back as far as February, we started cancelling elective surgery, planned surgery, cancelling clinics, discharging as many patients from the hospital, such that when we started admitting COVID patients, the hospitals were largely empty of non-essential, what we considered non-essential activities. So these were planned operations and other planned treatments. But the National Health Service always remained open to emergency cases and urgent care cases. I've heard a lot of the stories, and in fact, I know of relatives and friends and who have suffered as a consequence of the lack of access to healthcare in Nigeria. I must say that the main reason for that is the lack of adequate personal protective equipment for health workers in Nigeria. And working with colleagues, there are many groups helping to support that effort. And we have set up a group called COVID Nigeria Medics, which we are collaborating with colleagues in Nigeria and have produced, thousands of items of personal protective equipment that we're distributing to the bigger centres that are seeing COVID patients in Nigeria, hoping that it would help reassure staff that if they're safe enough to see other patients. Many health workers have been infected. Some have sadly died. And it is totally understandable, but actually a preventable tragedy that many people with non-COVID problems have lost their lives or have suffered because they've been denied access to healthcare. But again, health workers, are scared, frankly, understandably so, that they're being sent to the front line without the necessary protection. And that is a tragedy. That is something clearly, when this all settles, that the government must look at and learn from this going forward. Because unfortunately, this won't be the last infectious disease. It won't be the last pandemic that we see, and we need to plan better in the future.
On a final note and on a lighter mood, we did receive some footages here, even from UK as well, about this 5G that had a lot of people freaking out. Are people still talking about that over there?
It is still on the fringe. You always find people that talk about conspiracy theories. But certainly, as you say, earlier on, there were people that were actually going out and attacking engineers that were installing 5G masts or servicing them. But that has since died down as it's become clearer that there is no truth to that at all. But when people are scared, all sorts of conspiracy theories come out, and people clutch to any straws that they can find. But it's not as much an issue as it was several weeks ago, or a couple of months ago.
Thankfully so. But we do thank you for your time this morning. And these days, we tell everyone, including doctors too, to stay safe. So I might as well tell you, stay safe out there.
And same to you.